All right, so we're starting with the 25 vitrectomy. What really jumps into the eye with the Trocar system is that the Trocars are perfectly orientated. You just take them out, stick them in, and they have the perfect position of the blades. Now what you also see is that you have these tiny dots here at the side that give you a good orientation of how you want to put it with your finger, so you don't really have to look at it. And the trocar really falls in your hand, it falls into the right position, and it intuitively wants to be positioned well, this trocar. Now this is the new lid system that we have here. You can feel the click with a little bit of resistance, therefore I always use the forceps. Now, quite like this tiny clicking system. Now with the other trocars, what you can see is that you can measure the distance very easily. I think that's a nice upgrade that we have here, and the trocar goes in smooth as butter, which I also like a lot. Some trocar systems are really sticky and not very well designed. Now what you can see here with the lids, you could possibly take them off just in case that you want to insert something into the eye that is a bit bigger. Comes into mind is that the instrument, considering that it's 25 gauge, they're really stiff in your hand. And as I'm removing the vitreous body, to visualize it a bit better, I can just give it a flick of my foot and change the light setting. And these are kind of extreme light settings induced in the posterior vitreous detachment. Now what you can really see here, considering it's 25 gauge, you can see the 40% increase in effectiveness and vacuum. It's really something that you can see and feel. So this feels more like a 23 gauge vitrectomy regarding the effectiveness, and you can really see that there's something moving inside this porcine vitreous body. Now I'll be switching to my, let's pretend that this is a pseudo-phakic pick. So I'm doing in a standard peeling case, I just do my peripheral vitrectomy. Now with the occlusion sound that you can hear, that we are actually cutting within the vitreous. For me, this is always a good reaffirmation that we're actually cutting vitreous. The beeping sound or the occlusion sound. It's very important to know that it doesn't mean that the occlusion, if you have this beep, doesn't mean that the vacuum is increasing or something like that. It's just that you have some vitreous within your cutter. Now you can see very effective. When I put in my vital dye and I switch back to the Venturi pump just for a nice and easy and fast removal of the blue. Now obviously there's some vitreous remnants left here, as you can see, as this is the pig eye. All right, then, and as in order to increase my visualization here, while I'm peeling, I can just give it a flick of the light, and then you can see that the contrast within the eye changes. And this sometimes, if you look at this blue cloud that I want to peel, as I'm changing the light, you can see that the borders more or less better. So I do that in every peeling case, that I switch the light settings quite a bit just to give me that tiny edge of the visualization. Now the peeling case is done. Let's not forget to remove the membrane. So the 30% increase in stiffness you can really feel as you're entering and exiting the eye. or probably entering the eye, you don't have to really worry about bending the instruments anymore. Now we're ending the case, and as I'm removing the instruments, the trocars, just have a look at this sanded area that gives you more stability inside the scleral wound, but it's still very, very easy to put in and to put out.